Good evening, all. So, welcome all of you to our very innovative and unique top preparatory course for the upcoming theory exam for DrNB as well as DM Critical Care Super Specialty exam. And myself, Dr. Tapas Kumar Sahu. I know most of you have not known me. I am the founder director of 360 Critical Care. Along with me, Dr. Sananta Kumar Das, who is also the founder director. He is in Australia. So, Sanant, are you here? Okay. So, because of the time difference, so he is right now not joining. I think he would be trying definitely to join in between. And also with me, there are my course faculties. Dr. Niharika from Baptist Hospital, Bangalore. Hello, Dr. Niharika. Welcome to the webinar.
Hello, sir.
And with also me right now, Dr. Srihari Rajkumar, and he is also the consultant in Royal Care Hospital, Coimbatore. Am I right, Dr. Srihari?
Yes, sir. Yes. Yes, sir. Yes, sir. Yes.
Perfect. Perfect. Very bright, young, dynamic student. And recently, he also completed DRNB with the flying colors, and he's right now the consultant there. And with me, I'm really proud to announce that one of our faculty has won the gold medal in the DRNB exam at the national level, and he's getting the gold medal right now at the convocation ceremony in Bangalore. Dr. Darshan Prakash, and he has said he's like the best wishes to all of you. Most probably he would be joining after he receives the gold medal from the governor of the Karnataka government, and he would be the also course faculty along with our the faculties. And also with us, Dr. Bhubneswari Raja. Again, one of the brightest student I have ever come across. He was our the attendee as well as participant in our EDIC 1, EDIC 2 preparatory course, successfully cleared. And in the meantime, during the DRNB also, he cleared EDIC also. And also she has cleared the DRNB. So she is right now the consultant at Manipal Hospital, Bhubaneswar. And also there are many faculties who have shared their best wishes to all of you. Now, from all of you to our faculties, so I'm right now getting the names of the attendees. Dr. Shruti from Medanta Gurgaon, Dr. Priyojit Bagchi from Desun Hospital, Kolkata, Dr. Akash Mehurta from Max Super Hospital, Baisali, Dr. Madhusmita Bishwal from Medanta Medicity, Gurgaon, Dr. Gunjan from Medanta, Ranchi, Dr. Prasant from SRMC, Chennai. I just want to know if somebody is sharing it, it's okay. Otherwise, we will be just starting with our presentation. I just want to know that we have the attendees from all over the country. Dr. Sandeep from Holy Family Hospital, Mumbai, Dr. Nitin from AIMS, Jodhpur, and there would be many more who would be joining later on. Anyway, we are recording this webinar, so it would be also helpful for those people who are going to miss it because of their prior engagements as well as some of their hospital commitments. Now, with the due permission of my faculties, and right now I have my core team members, Miss Ni Bhagyasri as well as Mr. Navneet. I am starting today's presentation, that is how to prepare for DRNB and DM exit exam. Let's make it very interactive. Don't be scared. This is just a teaser for all of you, and you will get lot of study materials, lot of classes, lot of informations from our the whole team in subsequent the classes. The aims and objective of starting this type of course, I would be also right now highlighting the time when we thought about starting one online education academy. That's again for the critical care, which was not there during my the super specialty. At that time, it was FNB. I have cleared my FNB from Sir Gangaram Hospital, New Delhi. And then I went to Toronto. I did my fellowship from St. Michael's Hospital, Toronto and Canada. And then I came back. So my colleague, Dr. Sananta, who is also the founder director, So he also passed the FNB from Indraprastha Apollo Hospital, New Delhi, and he went to Australia. And now he's the consultant there after clearing all the exams there. So we had no opportunity to know about how to prepare for this type of super specialty exit exam. We are all busy in our like clinical work. We were having classes by our respected teachers, but somehow we were drowned in the ocean of data, information, and knowledge that was like shared by the patients from the teachers. And also at that time there was not like that type of digital media education that has like started. So when the digital media education as well as like we were inspired a lot by the current digital tycoons, those who are like very active in the online education in some other fields. It's not about the critical care or medicine as a like whole, as a general. So we thought about why not we can reach to the people who are not getting the best of their education from their own hospitals. So it is not always the metro cities that the people are right now having their super specialty critical care examination. And it's not the fault of the candidate, the doctor, the bright young mind that he or she is working in some of the tier 2 city or tier 3 city, and he or she is not getting that right education at their doorstep. So that's the reason why we started this 360 critical care, and many of you know about our activities, our online educational materials. And in the meantime, for last 2.5 years, almost I would say 500 AD people have right now cleared their exam, and there are like almost 200 plus DrNB as well as 50 plus DM candidates have cleared their examination in the first attempt with very bright marks, I would say. And very they are right now working in some of the bright hospitals, very good hospitals, with confidence. And it's not about the marks, rather they have also gained the confidence to work as a true intensivist. Now, the aims and objective of starting this type of course for the first time in India, we all know critical care super specialty is ever growing. And currently, if you also know, the examinations that we are finding, maybe it is DrNB, maybe it is DM, maybe it is European diploma, maybe it is the other Indian Society of Critical Care Medicine exams. They are getting more comprehensive. I expect my co-faculties also will agree with me. They are getting difficult because critical care is actually super specialty of medicine. It is not like I would say core anesthesia, core pulmonology, or core medicine as well. It is acute care medicine. So the examination definitely need proper planning to pass. And for this, if we are talking about the exam, I'm not talking about the clinical practice, the day-to-day clinical acumen. We are right now focusing more of like the preparation that you should do so that you can clear your exam with confidence, with knowledge, and definitely that would be for lifelong. So that's the reason why your preparation need to be guided, and that has to be started early for getting the success. So that is the basic aim. Now, if we'll be discussing about the super specialty 3-year courses, that is DrNB and DM. So it consists of various exams in your 3 years of your curriculum. One is the internal exams that comes every 6 months or so. That is FAT exams or internal assessments. They have their known nomenclature in different hospitals. Now the second one is the theory exam when you are like appearing the theory at the end of your 3 years. Now after you clear your theory, then it would be practical, and the practical consists of bedside clinical cases, table vivas, grand vivas, and thesis checking. So this is the rough idea of the number of examinations you need to clear or you have to pass before you will be labeled as yes, he or she is officially granted or qualified intensivist. That is the nutshell description of your like the qualification as well as your education. Now, if we'll be talking about the exit exam, that is the first hurdle, that is the theory. It comprises of 3 papers. Everybody knows it. Each paper carries a weightage of 100 marks, and 3 hours is the stipulated time for 10 questions. And the 10 questions, it is not always that it has to be a question, single question. It has like also sometimes sub questions. Like there would be two questions, five. There would be one question of 7 marks. The other subset of question would be 3 marks. So 7 plus 3, and each question would be not only like no didactic, like no the severe acute pancreatitis. No, it is never asked like that. There would be the questions would be in the format of pathophysiology, etiology, classification, risk factors, and management of pancreatitis. Or they may sometimes will be like no missing, or like no they will not be discussing about the pathophysiology or the theoretical part. Rather, they may sometimes in the second part or third part would be focusing more of management of complications of severe acute pancreatitis. Or maybe in the third part, which is of recent advances, they say that third part normally consists of the recent advances. So they may ask you simple question, controversies around severe acute pancreatitis. Question, 5 mark question. Controversies around severe acute pancreatitis and recent evidences related to severe acute pancreatitis. 5 plus 5. That can be also asked. So you need to know that which are the questions, which are the mark distribution for each question, and how to approach a 5 mark question and a 10 mark question, a 3 mark question, sub question, or a 7 mark main stem question. So if a 7 mark question is there, then you have to at least answer little bit in detail. A 3 mark question, maybe you have to be short in very much bullet points, or you can just answer in a like no infographic way. So that would be giving you 1.5 to 2 mark or 3 mark. But if you are spending more of space as well as your like the time for the 3 mark, 2 mark question, you are anyway going to miss the like no major difficult 10 mark questions from writing in detail. So that is the essence. Now, coming to the basic outline of the exam. So these are some of the things that you should remember if you are like now in the final year or second year or the first year. But you need to know what you are going to get when you will be appearing for your theory exam. It will be also helpful to you if you are also planning to appear for your FAT exam. So like no few days before only I got one phone call from one of our attendee that my practical exam in the second year is coming up. How I should prepare? I have cleared the theory. So during your year also, it's not only for the final years, but rather second years, first years, they would be also have their FAT exams in between. So you need to know that the paper one in the final exam, it would be mainly the asked about the critical care basics, applied physiology, monitoring, and statistics. This is the rough idea. Look, the examiner, the board of examiners, they may like reshuffle little bit. The statistics may be asked in the third part. So it is not always a watertight compartment that yes, statistics will be always paper one, recent advances will be always in the third part. It is not like that. But it is more or less whatever we have observed over last 5 years. This is the format of the exam or the division of the topics in the different papers. Now, paper one basics, applied physiology, monitoring, and statistics. Paper two is related to the systems of the critical care. So it may be gastroenterology, hepatobiliary, it may be nephrosciences, it would be endocrinology, it would be like the hemodynamics, something like that. Now, there would be also some interdisciplinary topics like transplant, maybe end of life care. There can be also question related to the oncosciences, oncocritical care. So that would be of like no the interdisciplinary divisions. Now the paper three would be also, it is always difficult to have like no all the systems, the whole body in one paper. So they sometimes can ask nephrology, cardiology, neurology in the paper two. Paper three will be like no having toxicology. Paper 3 can also be asked about like the recent advances, some of the burning issues, some of the controversial topics in the paper 3. So this is the rough idea about the outline of the different papers that would be asked in your theory exam. Now, many of you are stressed and few are going to be stressed, not by mere of like today's presentation, but I would say the final year students now of the DrNB and DM, they have only 4 months to go. And definitely they must have like witnessed or experienced nightmares that how I am going to finish the whole version of critical care in next 4 and 5 months. Now the second year candidates will be starting to have nightmares looking at their seniors, because they would be also having their seniors in their hospital. So they would be now starting to gear up by trying to cover the topics as well as getting stress. So looking at them, the second year students would be right now having some or other skipping their heartbeats. Now the first year students who have just recently joined, they would be also feeling that what is happening, what is this collaborating. Now, there are also, we have joined recently. Now, the thesis topics have been assigned. We have been asked to write about our thesis, the objectives, then the inclusion criteria, the outline, and we have to discuss in the our ethics committee board. And now just we have joined, we have started to work. Despite all of our efforts, now the FAT exam have come. So they must be also having some or other this type of nightmares. So don't worry. Now there would be some or other the final year students or second year students, they would be very confident that no, Dr. Tapas may be talking about something to just create curiosity among us, but it's not like that. I have prepared well. I have started no the my preparation from day one. We got the feedback from our seniors that this is the way you should start reading, or you should have their your own notes. But how to answer it well in three papers, and now after going through my hectic duty schedules, and only 3 or 4 months are there. Now how to sum up all the things and get the best result. So that is also another point some of you bright minds must be having. After reading everything from the digital media, from the books, from the your own notes, spending sleepless nights, ocean of study materials are there. There are many students who have accumulated almost, I would say, bag full of notes or printouts, review articles, presentations. Their desktop is full of review courses. There are lot of e-books. There are sections in their desktop, iPad. But when to start writing? So that is also a $1 million question, because we have written theory questions long time back, almost I can say 3 year back, 4 year back, and we are not writing also our notes anymore. It's like no short forms, CST, continuous time treatment. So how to write I would say 2 pages, one question, 10 questions, 20 pages, 3 days, 3 papers, 60 pages. Can you imagine? 60 pages right now somebody would be asking you to write, and that also pass or fail decision is depending on that how you are writing. So people would be definitely frightened. So again, that is also one more the cause of your query, your worriness. So if you will be just summing it up, definitely I am also right now trying to increase your stress by saying there are certain housekeeping rules. Only 2 pages per question in your exam. You cannot write, if you are so confident about severe acute pancreatitis, and you would say that no, I have gone through lot of literature, and I know in detail the molecular mechanism of severe acute pancreatitis, and I would start writing 5 pages I have written, so the examiner would give me 12 out of 10 marks. Don't be in that type of confusion. You are going to get only 7 or 8 marks out of the 10 marks. So if you are utilizing one question for 5 pages, so you are actually going to have last question in half page. So definitely you are getting the probability of marks in the last question would be less than 50%, because you are only writing half page where you have written 5 pages for a single question, that is acute pancreatitis, and the question was asked the mechanism of your the severe acute pancreatitis or the complications of severe acute pancreatitis. So this is again some of the housekeeping rules people they just tend to forget during their the high voltage preparation time. You cannot deviate from the question objectives. The examiner would be only looking at you have written the complication of the management. If the question is asking about complication of management, if you are writing starting with the complication of management in the form of severe acute pancreatitis necrosis, then walled of necrosis, pseudocyst, pancreatic abscess, or chronic pancreatitis. He or she, the examiner would be only giving to those points. If he or she is not getting those points, he would be not interested in going through your essay. So I want to just make it very clear. If you are writing less than expected, you are anyway getting less marks. If you are writing more, you are actually compromising in writing about the other last questions. So anyway, you are also going to get less marks. So the final result, you are getting less marks. So I am not trying to again just frighten you, but these are the things our previous batch candidates, after attending the first introductory webinar, they told that the same night of the webinar that today we are right now having, so you will be having my worst nightmare, and I will be completely having sleepless night by getting such of the nightmares. But don't worry, your stress level again will increase. There are some of the examination papers you would be getting little bit of. It is not the exact paper, but the examiner may write like this: cross bad, may not be writing bad, but yes, the marks would be 1 out of 5. There would be like 1.5 out of 7 marks. So finally you will be getting something which you are never thought about to get, at least at this age of your life. Now, problems. I am only highlighting about the problems, don't worry. So we need to also know what is the right way to answer in the theory. I am only highlighting about the theory because that is the first hurdle. If we will be passing that hurdle, then the next hurdle or the level of your game would be there. So we'll be discussing that at the right appropriate time and place. Let's take an example: OP poisoning, clinical features and management. Dr. Niharika, if you would like to take this question, I can just continue with the presentation and you can explain. Or else, if you want, I can continue. Okay, no worries. Now,
sorry, sir, you continue, sir.
Okay. So now, if somebody is right now asking about the question organophosphorus poisoning, clinical features and management. So in our class, we always advise also to our students. In my own students are there are my own students in this webinar also, DrNB students, that you should always think about having a structure in your mind rather than starting arbitrarily A to Z. No, the question asked about clinical feature, so you can just start with the clinical features. What are the basic symptoms and signs? And again, have one structure like nicotinic receptor stimulation, muscarinic receptor stimulation. And on that basis of the receptor involvement, the manifestations are like this. Can you imagine how the examiner would feel if you will be writing neuromuscular junction, autonomic ganglia, adrenal medulla, and the manifestation are this. Now coming to the muscarinic receptor, M1 to M5, CNS, heart, pupil, exocrine glands, and smooth muscle. And you can just highlight the points. You don't need to write also full sentence. It gives that extra edge over the other candidates who have wasted their time in writing 8 lines, 10 lines just to explain these things. Now, you can also have another form of your answer in the field of muscarinic features, nicotinic features, CNS features. And you can remember having our age old practice of remembering the easy things: diarrhea, urination, meiosis, bronchoria, bronchospasm in some form of dumbbells, nicotinic features, CNS features. Now, then you can also divide the poisoning based on the type of poison, the symptoms and sign, based on whether it is like the carbamates or it is organophosphorus. So on that basis also you can divide the clinical presentation. Now, you can also a plethora of information like neurologic manifestations in the form of weakness, unconsciousness, cerebellar manifestation, neuropsychiatric symptoms, extrapyramidal findings, ocular findings, and other features. Again, just what I have told in the tabular format, you can also remember in the form of muscarinic overstimulation, nicotinic overstimulation, and again with certain forms of like the mnemonics that would be easy to like reproduce on your piece of paper in your theory. So that also you can write. Now, the symptom of sign again can be divided on the basis of time of manifestation: acute, delayed, late. And again, spectrum of delayed manifestation on the basis of time of onset of manifestation from the time of ingestion of that OP compound. So the way how you are producing on your piece of paper on the day of your theory exam, that also gives like the confidence that yes, I will definitely get 80% at least from each question. So if somebody is writing in this fashion, anyway, he or she is saving a lot of space, and on the paper, it looks little bit of neat and clean and also very much organized. So the examiner would be only looking at the headlines, how you have written. And then he or she will not be entering, at least after 2 to 3 questions, he or she would be so much confident that yes, this candidate knows about the concepts and he or she is putting it on the paper in very streamlined fashion rather than having like no the writing diarrhea on the piece of paper. No. And coming to the management part, again, based on the mild, moderate, and severe, starting from the termination of the exposure, gently cleaning, airway control, adequate oxygenation, use of the atropine, monitoring, the complication management, and finally, you would be also having some or other systemic manifestation management. So that if you would be writing in a very much structured template fashion, then the examiner would be forced to give you, I bet, 9 minimum out of 10 marks if it would be in the format of like some structured template. Now, coming to the initial management, then the pharmacologic management. Again, pharmacologic management, two things are there: atropine, pralidoxime. There are certain endpoints of your atropine use. There are certain like concern with your atropine use. Then what is the dose of the appropriate atropinization and how you are going to titrate your atropine dose. This is all about your atropine. So 4 lines, I'm able to finish my atropine concept. Now coming to the pralidoxime, what is this? When you are going to use, what is the evidence currently, when you are going to use it, and after what time you are not going to use it. If you are making it very clear on your that exam day on this your theory paper, then the examiner would be very confident of giving you full marks. If you can create, if you are an artist, you can create some or other infographics on the piece of paper, that would be giving some extra the age that yes, writing so many things and just making some or other bullet points or some or other mnemonics, something like that. So that would be also a very impressive for the candidate for the theory exam to get good marks. Now, to summarize, I'm just giving you one example about OP poisoning. It's not that it would be always the same question that would be, or the same type of structure template would be there. But yes, if you can develop a structure template for each question, so nobody is right now going to get away those 3-4 marks that you are missing after writing so much, so extensively on your day of examination. To summarize, read the question completely, look for the subdivisions, don't be in haste. Once you get the paper, okay, severe acute pancreatitis, let's start it. I am right now trying to totally vomit all the information that I have gathered in my last 3 years. No, look for the subdivisions, give 10 seconds of your time in thinking about how I should have this question answered on 2 pages of the theory paper. Answer to the point, use diagrams, info diagrams, scientific diagrams. It's not like you will be having artistic diagrams of creating lungs and heart and the brain, making all those connections, making all those different colors to highlight. No, it is not needed. Maybe it would be scientifically, or the essence of your diagram is to explain it easily and make it crisp and impressive. So that is the whole idea of writing a theory question on your day of your examination. How do we ace an any exam? If somebody is asking, understand the format, the format of the examination, theory exam, we all know the DRNB, how has been conducted for last few years. Plan and organize your time, the remaining time, you are like, despite your working schedule, you have to organize your time to finish all the important questions that has been asked. What are the questions that can be asked, so that you have to prepare your own question bank, effective study techniques, discussion, review, reflect, practice, and practice, because there is not a shortcut than these three words, PPP. Exam day strategy. Again, every day is different. We all know about Neeraj Chopra. He was the gold medalist contender, but what the things happened on that day of examination is what counts. So if you don't know, despite all your preparation, that day of your examination is also sometimes very important. And finally, stay healthy for next 4 months, next 1 year, next 2 years, next 3 years. Now, coming to the top course, that what we are planning or we are having, we are coming up. We believe in making critical care education simple and precise, systematic and organized to alleviate the stress from our candidates. Always have personalized approach to the young budding intensivist, because definitely it's not like all the fingers are equal. So we need to have the extra help or sometimes hand holding that we felt our time it was lacking. So for that reason, sometimes we feel that we need to be very much compassionate to our young trainees, and we want to make also the learning joyful, and examination should be just another day at work. If you know you have worked diligently, like sincerely throughout your 3 years, you have gone through the theory, you have read the most important the concepts, then it's like just another day of your work. And we bring experienced faculty and experience of previous courses that we have conducted to make this exit exam stress free. Now this is the last time, if somebody like known to you or senior of you have attended our top crash course, so they know about our course. It was conducted in the month of September 2023, second and third and 9 and 10, and we have done almost 5 hours of marathon classes, 4 classes, almost of 20 hours. And believe me, 100 plus candidates have glued to their systems starting from 5 p.m. till 11:30 p.m., 12 a.m., midnight. And they were still asking, sir, please continue. We are still in the perfect senses to attend all of the other remaining questions. So that was the beauty of the top crash course. And I am so happy to tell 95% of candidates have cleared. Only 1 or 2 candidates, they have not appeared the exam. Otherwise the theory exam was cleared by everyone. It is not like what I am saying. The result and our the feedback from the candidates were so overwhelming. Now I am trying to present the DrNB DM top course that we are coming up, and already we have shared the flyer with you. I am not going into detail of that. You all know the salient features of the course. We would be sharing the study materials prior to the class, so it would be there would be for every month there would be four the weeks. 4 weeks will be having for 4 domains that also we have shared in our flyers. Like first September month, gastroenterology and hepatobiliary, neurology and neurosurgery, cardiology and cardiac surgery, respiratory system and mechanical ventilation. Now, if we'll be starting from September 1, every week, we would be sharing with you the relevant articles, review articles, but it has to be precise, concise. We are not going to have lot of information to you. Anyway, you are studying some or other textbooks. So we will be only supplementing with some or other very good article which would be of 2 pages, 3 pages maximum. Otherwise, you will be having again, no, there would be folders full of information. No, we don't believe in that. Now, at the end of that week, we would be having a very extensive class. The first class will be taken by me, gastroenterology and hepatobiliary on September 8th, that is the provisional date. And that would be having almost 15 questions from gastroenterology and hepatobiliary, those were asked in last 5 years in various DRNB and DM exams, and that would be having extensive discussion. So it would be not only 3 pages, 2 pages, it would be also highlighting the importance of that question. If it is severe acute pancreatitis, so you will be getting everything that you need to know. May not be a complete from the book, but yes, most important things should be discussed, and that would be live class. And the somebody, if he or she is missing it due to some the accidental things that has happened or some hospital commitments, then next day morning it would be uploaded in your Google Drives, and you can watch those discussions for next 4 months till your exam is there. And then at the end it would happen every week. The next week it would be neurology, neurosurgery, it would be repeated again, cardiology, cardiac surgery, respiratory system. At the end of that month we'll have one mock test. There would be theory questions just to get you acquainted with the way how you are going to answer in your theory exam. So there would be some questions from gastroenterology, neurology, cardiology, respiratory system that would be asked to you one day before the, again there would be one live debrief, and we will be trying to explain you the model answer to the questions that we asked in the mock test. So that would be one extra class. So it would not be very elaborative 10 questions, but yes, we will be just only showing you the template that yes, these are the points you have to answer, you have to write. And we can also show you one paper, how one paper has been written extensively, who has got 9 or 10 out of 10 marks. How does it look like? You should also sometimes see the Roger Federer match or the Djokovic match to know how toppers they play. So that's the same thing in critical care. Now, the next month it would be domain 2, October. It would be again having 4 things: nephrology, obstetric, critical care, hemato, onco, immunology, toxicology. And at the end, there would be a mock test based on these 4 domains. Then November, there would be sepsis, infectious disease, organ donation, hemodynamics, miscellaneous. Miscellaneous will consist of many things. So we are not making it very clear, because yeah, otherwise the flyer would be of 4 pages. So we don't want to make it so extensive. Yes, miscellaneous, whatever is not there, it would be in the miscellaneous. And almost there would be 150 questions. 150 questions you would be getting discussed in detail by our expert team of faculties, Dr. Niharika, Dr. Darshan, Dr. Srihari, Dr. Bhuvneswari, and they have all gone through the DRNB and DM exams. They have cleared it successfully. So always it's better to get somebody who has actually gone through that same hurdle and prepare their there are notes and they are sharing with you. And then after that mock test 3, there would be one grand mock test. That grand mock test would be consisting of 3 papers: part 1, part 2, part 3, just in the same format like your upcoming theory exam. And you will not get only gastroenterology in the mock test 1. No, it may be asked neurology questions in this, maybe one from oncology, maybe from organ donation. So it is just real cell. You're 1 day 2 day before, how you are going to read the whole critical care. The same thing you are going to have in the mock test. And we'll be also having one debrief where we will be shown look, these are the things that you need to write for the last time before we say you best wishes. So this is the concept in which we have brought this first time mega preparatory course for theory, and we believe that this would be definitely helpful. I have already discussed this part previous questions, and then the whole syllabus would be discussed, didactic classes would be there, mock exams would be there, and the theory exam would be always having the discussion stem. I have already told structure template, and I would show you one example of stem if the question is about how the proning helps in the improvement of oxygenation. This was asked in AIMS DM exam December 2021, paper 1. And this is the structure template that we wish to share with you. If you are starting with, the following is the physiologic effects common to both intubated and not intubated patients when the patients are prone: decreased lung compression, homogeneous transpulmonary pressure, then improved VQ matching, decreased P-Cili. In addition to this, if there are certain additional effects in the ventilated patients, like you're facilitating the secretion, drainage, reduction of the villi, effects on the other organs if you are putting the patient to have the prone position. This is the physiology of prone ventilation. If you remember in this way, and if you are writing 2 lines in short from each of these subdivisions, nobody is going to give you less than 9 or 10 marks. Now, our aim is accuracy and precision, and we believe that at the end of the 4 months course, you will all be on the left side rather than using so many gears. Still, you are not having the accuracy and precision. And I know all of you know this guy, this gentleman. And at the end, this is the last slide. We'll also be coming with the practical. Don't feel that we'll be leaving you before your final hurdle. We are only giving you one teaser. Then at the time of your practical exam, there would be no help. We would be coming up with the practical. But yes, first we we'll be ensuring that you will all clearing the theory exam. One thing at the end before I will be concluding is we will be also having mentoring, the mentorship in our this course. What is that mentorship? We are 6 faculties. If we will be having, I'm just giving you example, 50 candidates. So we will be dividing each faculty with the, if it is 50 by 6, so it would be 8 candidates per faculty. So I would be taking onus of those 8 trainees. If they have any problem in this upcoming 4 months, and if they have any queries, they have difficulty in understanding something, they are not very sure how to approach the exam, how to start preparing, so they can directly call the concerned mentor for that group, and that person would be having one-to-one interaction, helping that guy to have the confidence and overcome the fear. So that is again one more thing which we thought about starting. So with this, I come to end of this discussion, and now the forum is open for any of your queries. And I would request Dr. Niharika, Dr. Srihari, and if somebody else also have joined. Sanant, hi Sanant, I missed you.
That's all right, Tapas. Yeah, I will wait for the comments from the other faculty before I speak again.
Yeah. So, Kirti, you have written about what sort of materials you will provide. Articles, a whole. Look, if I am taking care of the gastroenterology and hepatobiliary system for the first week, so I would be sharing with you severe acute pancreatitis, acute liver failure, or some or other very well explained and very particular, I would say concise and most sought after article, and it would be hardly 2 to 3 pages. It would not be of no the very detailed starting from theory and going into the molecular level. No, because you are all preparing for the theory. We don't want to burden you with lot of information. You all know you have your textbooks. You also have e-books and other articles. Theory model anesthesia will be for all 150 questions. Didn't get it. Ideal papers only. No, those are the questions collected from last 5 to 7 years. The real questions. We have not made those questions, but these are the real questions that those were asked in the AIMS or no JIPMER or the other DM Tata Memorial, SGPGI, DM these institutions, and also from the various national board DrNB exams. If we miss classes on Saturday, Sunday due to duty, you will be getting that recorded debrief next day only. So that is not a big issue. Materials, yes, you will be definitely getting. It is not dependent on your attendance in the class. Yes, I was coming to that only. So I have shown you the FAT exam. So this would be something which would be helping you to crack your FAT exam also, and also prime you before the the final hurdle Olympics. So that would be helpful for your national games. So for second year. So when you will come to the third year, it would be cakewalk for you. So definitely. So there are many students who have joined last time. Those are from first year itself. They just want to finish it, everything, what to know, what to read, what are the course materials. Anyone who has any questions, or else Sanant, if you can just share your
Yeah,
views.
that's a good point that Tapas you made regarding various stages of the training people join this course with various aims and various what you can call take out things from the course. For the first year people who are very junior, we do give some, not some, I'll say we give a comprehensive idea about how to read a subject. So there are loads of books, loads of resources for each of the domain of critical care. Suppose you are talking about gastroenterology sense, so we'll talk about gastroenterology. You need to know what to read about it. What is the most important things that you need to know as a first year student or second year student, and how you build up, rather than going into a big book and trying to read from there, and how do you correlate what you have read to the practical aspect.
Sanant, I'm just interrupting. Extremely sorry. Dr. Niharika is actually leaving for her duty. So if she can just spend 1 minute or 30 seconds. Dr. Niharika, please, if you want to go, before that you can share your piece of information or advice. Or Dr. Niharika, she has left. She has actually messaged me. Okay, no worries. Sorry, Dr. Sanant, you can start. Yeah.
Yeah, so as I was saying, regarding the first year or the most junior trainees, it is beneficial to have a roadmap what you are going to study. For example, simple things like ECG, how you approach a ECG, how you study a ECG, so that at the end of the third year or second year, when you are facing an exam and you are given an ECG, it should be a very easy way or cakewalk, as Tapas said, to evaluate a ECG and talk to the examiner. So that's the aim of a first year person who is coming into the course. The second year person who has read a little bit and is still going to read a little bit focused on the exam, this course is the most beneficial. Will be most beneficial, I'll say, because he has some background knowledge and then capture on what we say and then build up his knowledge again. And of course, the third year people are most important in this because we want them to get through the hurdle, get through the line. Okay. So every stage of the training, this will give you a better idea about how to approach the subject, how to study, how to prepare for the exam, and correlate your knowledge that you gain with your practical experience. As Tapas was saying, this is a two-stage course. We initially have the theory preparation, multiple mocks for the theory, and then we go to the practical preparation after the theory exam is finished. So it will not leave you halfway. It will give you a ongoing care so that you pass the theory, you pass the practical, and get out of this place, right? So that's how the whole course is designed for. We will be not talking about practical aspects in the theory classes because there's no point, because you don't need to know those things at the beginning because they are going to be asked in the vivas or practical. So we'll keep those things away, knowing that these are not going to help you in the theory process. All right, so that's the whole structure and idea of the course, so that you get exposure, you get the preparation idea, you get the roadmap for preparation at different stages of your career. So it's not only for a first year student or second year student. Again, the first year, second year student will have access to our study material till they appear the exam, pass the exam. But it is not only for the exam goers that I'm talking about. So that's how the course, the beauty of the course is. That's the
So
point I wanted to
yeah.
make.
Thanks, Anant. There are a lot of 2-3 questions I want to just clarify. Yes, we will be sharing all information regarding important trials. There would be one part in the question itself that would be talking about the important trials, the relevant articles or relevant trials that we need to know. The practical would be completely different because after the theory, so there would be different registration process for the practical. Okay, Kanika, yeah. And there is one question in the chat box. I am getting it. What is the date until we are starting the course officially on September 1, because we will be that day releasing the resource material for the first week. So we don't want you to miss a single day, because September 8 would be the last date of your gastroenterology and hepatology reading. Because September 9 we would be loading with the second week neurology and neurosurgery articles. So you will not get any like no one more day to wait. So it would be all fixed. 7 days, 7 days, 7 days, 7 days mock test. So then again 7 days, 7 days, 7 days, 7 days mock test too. So we want you to register at the earliest so that you get to hold of all those articles and start preparing bang on time. Any other questions, or else we would like to any class in December. The December, there would be something which we would be getting from all of you. That yes, these are some of the topics that we want to have one class for the doubt clearing. So that would be the one part, and there would be a lot of mock tests. So we have categorically not posted any specific class in the month of December, because it's a festival month, and also there would be a lot of the holidays. So we have kept it just for revision sake. Ethics and statistics, yes, everything would be in the miscellaneous, and as well as there would be some of the other classes we would be taking at the end. No definitive Saturday or Sunday, but preferably it is Saturday, because we have to see to there would be some festivals, there would be some national holidays, there would be some or other long weekends. So we have to also take consideration of our faculties, but we would be definitely posting much before in the dedicated WhatsApp group of all the registered candidates beforehand, so that you will be getting to know. It will not be surprise to you that on Saturday morning you are getting information that there is no class today. No, it won't be like that. We will be having a dedicated WhatsApp group also, where you will be getting all the information, and if you have any query, our team would be helping you. Yes, you can open that recorded video at any time during that 4 months, of course.
There are some questions, Tapas, here. Somebody has asked about will you be sharing? Yes, that's done. The second one is automatically include practical prep, or we have to buy separately later.
It would be a completely separate registration, Dr. Kanika. Yeah.
Then mock test
Test
will
will
be
be
every weekend. I think it is not every weekend.
to middle of the week only, because every weekend there would be one class, no, about that particular domain. So we would be taking it in the middle of the week, maybe after the first month, September. The first mock test would be in the month week of the first week of October. So we would be informing everything in
We have
between, don't worry.
four mock tests in the whole
Yes.
course, isn't it? It's not every week. It will be only 4 mock tests, because there's no point doing a mock test for one chapter like gastroenterology. So it has to be 2 or 3 combined together going into a mock.
will
And what about mechanical ventilator? Yes, there will be classes on that and material shared to you about it.
will you send recorded videos even if we attend class? Yes, we'll be sharing everything to you, don't worry. If you attend also, if you don't attend also, this would be for 4 months till your date of examination. Like 4 months we have no mentioned, but it would be till your date of examination, fin no, your end of your examination theory. Okay, I think these are some of the questions. We are dot on 1 hour time. So if there are no more questions, Sanant, if you can conclude it.
Somebody has asked about articles or notes. Yeah, definitely there is no notes, because that's a stigma of all the students that the notes pass them the exam. It is not. So there are definitely no notes. As a clinician, you need to know how to read a paper, how to summarize a paper, and what information you want to take out of the paper to put it in a exam question. So we discourage any notes to be there, because that will not help you in any way. So there is no easy way of doing it. Yeah, relevant article where you can read from or like a concise article, those will be provided, but definitely no notes for sure.
Okay. Okay,
I think
Sanant.
the
So yeah.
questions.
So this is the thing that we want to show you before we conclude. So this is the sorry. Okay, we will be posting that flyer again in our dedicated group, this WhatsApp group. And if you have any queries, please connect to us. We will be happy to guide you also. Okay, perfect.
All
Okay,
right.
thank you all of you. Thank you all the attendees. Thank you all the faculties. I think the faculties have their night duties, so they have left. And we wish you all the best. And if you have any queries, please connect to us. Thank you.
Thank
Thanks,
you.
Dr. Sanant. Thanks, Navneet. Thanks, Bhagyasri.